And welcome to another Mark Bishop show on the Business Radio X network. You know, millions of people suffer from traumatic brain injury every year in the United States. But you know what? There may be a new hope. Dr. Huma Haida, on her amazing journey from Pakistan to Texas, has revolutionized the diagnosis and the treatment of TBI. Every year, more than 3 million people suffer a traumatic brain injury called a TBI. Now, while those are the reported cases, it's estimated that the actual number is 2 to 3 times higher. That's horrible. A TBI occurs from the sudden jarring of the brain, such as in a car wreck or a fall. Dr. Huma Haida is the founder and CEO of the National Brain Injury Institute. It's a big, hearty welcome, Doctor.
Thank you very much, Mark. Thank you for such a nice introduction.
Well, as I understand it, Doctor, when these events occur, the brain is rocked violently against the inside of the cranium, generating a shock wave that reverberates back through the brain, severing valuable nerve fibers and rupturing sensitive neurons. Did I get it right, Doc?
Yes, Mark, you got it very correct. And I'll add one thing to that the consistency of the brain has a consistency of an egg yolk or a jelly-like material. And this is enclosed in a cranial cavity called the skull. So if there are external forces applied to the brain that will result in violent shaking of the brain inside that cranial cavity or inside the skull, then this will result in the tearing and sharing of the millions of neurons and axons inside the brain. And this will result in development of a multitude of symptoms such as physical symptoms, cognitive symptoms, and behavioral symptoms.
Wow, you know, over, 90% of those with TBI, though, do receive a mild categorization. What they call mild, I believe, is suffer from a myriad of symptoms, though, much different from those who've received, a severe categorization. These include headaches, depression, dizziness, memory loss, and many other symptoms, correct?
That is correct, that out of the 3 million cases or 3 million TBI cases reported by the CDC, about 2.7 million or 90% of those cases will be classified as mild traumatic brain injury cases. But don't be fooled by the name mild, right?
Mm-hmm.
Because, patients with mild traumatic brain injury will also have significant somatic, cognitive, and behavioral symptoms that will impair their personal, professional, and social lives on a daily basis. I see lots of patients here in my practice on a daily basis, and with mild TBI patients, they will be suffering from the same intensity and frequency of symptoms as the severe traumatic brain injury patients do.
And the other issue, of course, is these symptoms may take days, weeks, even months to manifest, which has also made it difficult, I guess, to associate the cause of TBI with the symptoms.
Absolutely, that is true, because there's a secondary damage that starts to occur inside the brain after the primary damage. So the primary damage is the initial impact that can last for like a second or a fraction of a second. But that initial impact will start a cascade of metabolic abnormalities inside the brain cell and inside the brain nerve fibers. And as a result of that metabolic derangement or abnormality, that can continue to happen for days, weeks, or even months. So as a result, patient may not start to experience symptoms immediately or right away. Their symptoms may be delayed for several weeks or even several months. So it is our duty to educate an everyday American, also to educate all the providers to be able to screen traumatic brain injury several months after the inciting incident, because they are still at a risk of developing symptoms of traumatic brain injury.
Right. Well, folks, Dr. Huma Haida knows firsthand just how devastating this can be. In fact, you lost your husband to a TBI, and you've devoted your life to the study of traumatic brain injuries. This is why you founded the National Brain Injury Institute and the innovative techniques used to diagnose and treat patients. That'd be about right. Sorry to hear that too, by the way.
Yes, Mark, that is right. Back in 2010, we had this unfortunate tragedy happen to our family, and it was a very difficult time. And at that time, I decided that I wanted to treat patients with traumatic brain injury. And that's why I did my advanced training in neurological critical care. During my career, while I was treating patients in neurological clinical care, I realized that many of the patients, they were discharged from hospital and emergency departments with no real access to specialized outpatient care and treatment options. There was a much needed demand for this, but they were gross majority of the patients were not getting this outpatient care and treatment. So seeing this, I decided to start National Brain Injury Institute back in 2018. And since then, here at NBII, we have consistently strived to raise awareness on the chronic nature of this condition that impacts the personal, professional, and social aspects of many patients' lives.
Doctor, what is diffusion tensor imaging? Why is this technology so important in diagnosing patients?
Diffusion tensor imaging is an advanced brain imaging technique which has enabled us to see the damage that we were not able to see before. As we know that the damage in traumatic brain injury happens at the microscopic level. The first generation brain imaging techniques were not advanced enough to see the damage to the brain at the microscopic level. But we are fortunate now that we have this advanced brain imaging technique that is called diffusion tensor imaging. Mm-hmm. And it is crucial to do diffusion tensor imaging for patients who have suffered a TBI, as it can clearly demonstrate that damage exists, and it is instrumental in providing targeted treatment, rehabilitation, and future care for the patient.
Well, doctor, in the couple of minutes that we do have left, tell us quickly, what are the most common causes of these injuries? Do you have tips on how to avoid them?
Yes, the most common causes of brain injury are, number one, slip and fall accidents. Number two would be athletic-related injuries. And number three will be motor vehicle accidents. The effects of TBI can be mitigated by consistently using safety protocols such as seat belts, car safety seats, wearing helmets while riding a motorcycle or riding a bicycle. And also, very important is absence of driving while intoxicated. Other than that, we need to be thinking about eyeglass evaluation and also visual health, because when we are driving, eyes have to be in optimal condition so that we avoid any motor vehicle crashes. Also, it is important to have good general health and also vestibular well-being, such as hearing evaluation should be done. And also some environmental factors such as stairs, slick or slippery areas should not be there. Playground equipment should be safe. And similar potential hazards should be removed from the environment.
Listeners, Dr. Huma Haida on her amazing journey. She started this as the founder and CEO of the National Brain Injury Institute. Thanks, Doc. I really appreciate it. Listen, people can go to, I've got here, www.nationalbii.com. Is that right?
That is correct.
www.nationalbii.com. Thank you, Doctor. Wonderful. Good work, and just keep it up. Thanks for all the help you're giving us.
Thank you very much. I appreciate it.
You're welcome.